my name's Alyssa. I'll be your nurse today. Can I get your name and date of birth?
Devin Olson, 11/28/96.
Okay, I'm gonna perform hand hygiene. And then today we're just gonna be doing a head and neck assessment. Just to make sure everything looks okay. First, I'll just have you take off your hat. Okay, I'm just gonna look at your head and make sure it's normal cephalic. And then I'm just gonna palpate your scalp to make sure there's no abrasions or sores. Okay, good. Next, I'm gonna look at your neck and make sure there's no abrasions, and then just make sure that your trachea is midline. Okay, looks good. And then next, we're just gonna palpate your lymph nodes. So the first one I'm gonna do is the preauricular, and I'm gonna do postauricular, and then I'm gonna do occipital, and then I'm gonna go jugulogastric, and then mandibular, or submandibular, submental, and then we'll do the anterior chain, cervical chain, posterior cervical chain, and then I'm just gonna have you lift your shoulders up, and then I'm gonna do your subclavicle, and then last one we'll just do your parotid salivary glands. Perfect. Okay, now I'm just gonna look in your mouth. So first I'm just gonna look at your lips. They are moist and pink. And then I have you open your mouth for me. And then I'm gonna look at the cheeks, and they look pink and moist, no sores or abrasions. Next, I'm gonna look at your gums, no bleeding, a light pink in color, and no gingivitis. Then I'm gonna look at your teeth, no abnormal color, they're aligned, and there's no bleeding. Okay, then I'm going to look at your hard and soft palate, so I'm gonna have you look up for me. Hard palate looks rigid, moist, and pink, and then soft palate looks soft, pink, and moist. Then I'm gonna look at your tongue, so have you stick your tongue out. Tongue looks pink and moist, no sores or abrasions. Then I'm going to look at your uvula. Uvula looks midline, no swelling. And then I'm gonna look at your tonsils. Tonsils look pink, moist, and about a 2+ rating. And then I'm gonna look at your posterior pharynx. That looks pink and moist. Okay, perfect. Okay, next we're gonna look at your nose. So I'm gonna have you do the patency test. So I'll have you cover one nostril and breathe in, and then cover the other one, do the same thing. Perfect. Okay, I'm gonna look in your nose. Okay, it looks pink, no abrasions or sores on the septum, and then septum is midline and doesn't look like there's any discharge. Okay, and then the last thing we're gonna do is just palpate to your sinuses. So just let me know if there's any pain or discomfort. So we'll do your frontal sinus, and then we'll do your maxillary sinus. Okay, that concludes our assessment. Do you have any questions?
No.
Perfect. Then I perform hand hygiene, and then we'd be done.